welcome to Health and Wellness, BODI. This is TD and African Media, and I am Joseph Elijah Mensah. Health and Wellness is brought to you by TD and African Media as a way to inform and sensitize our communities on various health and wellness issues. So, because we want for reach all man, we go do this program na Creole. Today I get with me Dr. Sharon Abokie. Good afternoon, doctor.
Good afternoon.
Dr. Abokie, do you tell Fambulem who that's na you?
Okay, like you rightly mentioned, my name is Dr. Sharon Abokie. I'm a medical officer, currently employed with the Ministry of Health and Sanitation, and I'm currently posted now Bo Government Hospital, Bo.
Oh, okay.
Yeah.
Thank you, doctor. So, doctor, what do you get for we today?
Okay, before we start, first of all, I want to thank the network, TDN, for this opportunity, for giving at least the voice of the healthcare workers them, for able to inform with people them about certain things that way people they're not aware of. So thank you for that day. So today specifically we will talk about hypertension.
Oh, okay.
Yeah, hypertension are something where people they also call pressure sick or high blood pressure. I just say now that they more we familiar with. Okay. So now that they will talk about today.
Okay. So you want for enlighten people learn about hypertension or pressure as they can call them. Mm-hmm. Okay, so we see this get for be a very interesting topic because down in a team where don't they affect plenty Sierra Leoneans, them be young person and old age people them. So we go like for you from your side and make we learn waiting at the causes and how would you do for prevent them things there.
Yeah. Okay. So thank you, sir. We can start by understanding within this pressure sick here. High blood pressure, I should say now something where people are actually familiar with already. But when we talk about definitely one or two things they where at the end of today we go able to learn from the whole information. So high blood pressure, obviously, we as black man there and we as saloon man there, na sick way, rare, na sick way very common among we. And why we actually specifically decide for talk about and why I decide for pick that topic, because we go think like, but other sick than they way people then feel like they do more damage than high blood pressure. But the truth is high blood pressure, according to studies that way they don't do, we they see say it becomes something, the prevalence of the disease, they go more and more because of we lifestyle changes and many other factors. And in fact, we're lucky enough for get one of our own doctors, Professor Leaks, now a consultant neurologist. He actually do a study in Salonia on the prevalence of hypertension amongst people there. So you get some group of people in Freetown and even include people in the provinces. You get 3 villages in the northern province, about 600 people them in each group, and you try for give some questionnaires, then take them blood pressure, and they also try for determine some risk factors that will make them people them the one that will come up with blood pressure more disposed for get blood pressure. And in end up for see like 24, almost going to 25% of people then are Freetown being get high prevalence, people then can down with high blood pressure. Imagine just out of 600, we get 25, almost 25%. Then up country, we been get about 14 to 15% prevalence. So that day they show say even we in a salon, we follow the trend of the increase in prevalence of high blood pressure. So we really need for go back and say, is it that people they're not aware of or something they way people they not actually know where they make this prevalence here, they go high and high now we society. So now that make we decide for say, let's talk about blood pressure and try for make people them aware of So obviously we all know about blood na the body not to so. The heart they win at the organ within at the middle of the chest we invoke now for pump blood through different pipes then for make sure say every part of the body gets blood. And the heart they do in a way where it need a normal pressure at which it go able for pump this blood, make every part of the body get blood for able for carry out every function of the body go on smoothly. Yes, but where certain circumstances begin happening, and then the pressure get for pump the same amount of blood here at a higher pressure. You get for no say problem get for come out sometimes, no so.
Yeah.
It just start like guma no more. It just start like guma. The way then they give supply water to the whole of Freetown through pipes and everything. But if the main reservoir and not get enough pressure for pump water to the whole city, we know some parts and they not go get water, not so.
Yes.
So at the same time, if the heart get for pump the same water at a very high pressure and it not able for meet up, it means that the resulting problem go be say some parts of the body then no go get blood, some parts of the body then get for die and they not get for function well, which go lead to a lot of bad complications. So we go ask ourselves like waiting they cause this pressure, yeah. So before we know the causes of the high blood pressure, we get different types them we go able help with for understand.
Okay.
First of all, we get the primary high blood pressure and we get the secondary. So we're not going to go too deep. We'll just simple for make people that able to understand. Primary means that they don't do some studies. If you get primary hypertension, it means say you get certain risk factors that way go don't predispose you for get that pressure day, but no any underlying signal day where they cause the blood for go, the pressure for go up. But then the secondary means say you get secondary issue, other underlying issue day where they make this pressure for shoot up. And sadly enough, now more of the primary na prevalent, because for the secondary, obviously you know say if now an underlying problem they as you cure the problem, the pressure they go back to normal. But you see that primary hypertension, if you not correct, because nothing on the way they cause them, and like you do anything, you go see say the pressure still there because you not get one particular thing where they cause them. So we get certain things that we would call risk factors. We go increase your chances then forget that primary hypertension. So we go also not for confuse ourselves. We go also shed a little bit of light on the different types of factors, them the risk factors. So for make we able to understand that easily, we get the modifiable and non-modifiable risk factors then. So the modifiable risk factors just means say if you're able for change or you're able for alter any of them factors, then you go either increase or decrease the risks for able for get this pressure secure. But the non-modifiable factor, it means say like you're not able to modify them, you're not able to change them. For example, you age. We also see studies don't report say as age they go, as we they get older, we're more likely for come down with hypertension. So you see, you're not going to do anything about your age. Secondly, na the gender. Studies also just show say man they more likely for come down with hypertension than woman they. So you they see say you're not able for also modify that factor there. Also your ethnicity, also you come on, blacks are more likely compared with other races there for come down with hypertension. So this not so a very few of the non-modifiable risk factors then we will not able for change. But we get the modifiable risk factors that we now more now then on more we they try for shed some lights, because at least that side there if you're able for make some healthy changes, you go able for reduce your risks them of coming down with high blood pressure. So number one, we talk about smoking. Honestly, we don't get in a boku advice say smoking is bad for your health, smoking is bad for your health. Smoking are one of the risk factors there for condom with this pressure secure. So how smoking they cause them? We all know say by with cigarettes, with tobacco cigarettes, we get nicotine. We are a very bad content where they directly increase with blood pressure. Apart from that, even that smoker with the smoke, at times that pipe they were responsible for take blood go na different parts of the body. The smoke they try for cause some injuries to them pipes then they, and as then they well, we injure them as then they well, the tissue you know they come back like how if it been there in the first place. You know they get in initial strength where it been gets before. So it they be a little bit non-compliant. So they see say the walls there of the pipe, then they stiffen. And then if you had to get for pump blood against a very narrow pipe or a stiff pipe, you go see say it will need more pressure for do than the thus increasing the pressure of the heart. So you see say smoking directly gets something for do with this pressure sick here. And also we go think like now the people they no more way they sit down and put cigarettes now they must now they no more they smoke. Now they no more they smoke actively, but we also in one way or the other we they taking this smoke here passively. For example, we the woman the weekend day near fireside, morning, afternoon, evening, you they make fire and that huge smoke they take them directly. Or you also day near side where all day then they burn bush, then they burn something, you they inhale a very large amount of bad air. So all that they able for predispose you to pressure sick. Secondly, we dey talk about alcohol. Even though studies don't show say it's little amount of alcohol per day is actually good for the body, but then we know say a large number of people then they consume more than they actually need for consume, and alcohol also not a risk factor for this pressure sick here. Thirdly, now we diet and wetin we dey eat. We know say in West Africa we like palm oil, we like oil business, and we they take less of fruits. So all of them they are a risk factor, because for oils, most of the oils they're full of unsaturated oils. Unsaturated oils they actually predispose we forget what we call low density lipids. Then when are the bad cholesterol now we body, and what then they do, then they go block them pipe then way blood for the pass freely and narrow the road where the blood for pass, and therefore give the heart more work for pump blood now we body, and therefore increasing with pressure. Also, we get physical activity. Boko of we know they involve in something physical. From your house, you take bike, you sit down at keke, you go na office, you sit down there from morning till evening, then you do the same over and over again. Because we can feel say we sit down at we office and we desk, so feel say we dey work. But actually in physics, definition of work is if distance not there, if you not actually apply force in what cause a displacement, you actually not work it. So we need for encourage yourself to be physically active. And just like a consequence of if you sit down, you know they work, obesity, that's to say your body weight no more, your body mass index they increase way enough for be to the age where you dey. So all this now, as we can see, you able for do one or two things about the risk factors and they compared to age, sex, ethnicity, where you're not able for do much about. So now we don't understand the different kind, the primary and the secondary hypertension. We don't also hear small body modifiable and the non-modifiable risk factor. The next question we person go ask now, how me go know say I get this pressure sick? So pressure sick, other name for na a silent killer. What do you mean by a silent killer? Because the time where you dey get the sick to the time where you actually know say you get the sick, now a very long time, and usually by that time where you dey begin get signs and symptoms, problem don't actually already happen. That is to say, the hypertension itself, in 95% of cases, then is asymptomatic. That's to say, you know they feel nothing, they feel okay, you know they get no signs say your pressure day up. So majority of the time, and at this they come with the challenge where it come with the management and the treatment of this pressure sick here, because in it they show. You know they tell you, not so like malaria where you get on your body they hurt, they actually feel sick. But pressure, you able to go about your normal activities and then you pressure they up. Even we self now the healthcare system, majority of times that we can make a diagnosis of this pressure sick here. Now an incidental finding, that's to say the patient not come because of pressure, the patient now other thing now come with her. Now when we check, now we see. But cool people that we don't get instances of people that way they can at hospital or they walk around, sometimes they just fall down. You see them pressure 200 and something going over. You understand? So most of them people then they need to know. And before we even go ahead, now I don't talk about them, we need to know the normal blood pressure. According to studies, blood pressure usually reported as two figures then. We get it like how you they express fractions normal, 1/2, 3/4, and so we they express the blood pressure. Now the number where they up, we call on the systolic pressure. The one where they down, we call on the diastolic pressure. The systolic pressure now just the pressure at which that time the heart they contract. You know, see where the heart get blood inside and it get for compress for push that blood day out and then relax for accept more blood. So the pressure the time where the heart they compress itself for push out more blood, now we call the systolic. Then the time where the pressure at which the heart they relax for accept more blood, and we call the diastolic. So normally the one where they up they always higher than the one where they down. So normally with normal blood pressure now less than 120 upon less than 90 millimeters mercury. Anything more than that, if you not get any physiological explanation, anything more than that is abnormal, either physiologically or due to a disease process is abnormal. So back to it, we talk about presentation and how you go know say you get this pressure sick here. Most times it is asymptomatic, you know they feel nothing. Now when you don't begin get the complications of the high blood pressure, then depending on which organ don't begin get the damage, then you go begin see the signs there. If now you aid, you go begin get them kind of headache here. That's where they take Panadol, no more they take Panadol, you need a cold. That kind of head that day you for go to hospital. Or sometimes they begin feel dizzy, some little amount of confusion. You need for relax sometimes before you cancel, you need for check. If now the heart, sometimes you go to get chest pain, where you work as small, your chest go flop by you go need for sit down and blow, you know able lay down flat na bed, or you go sleep no more, you wake up na net, you dey strain for blow. Or sometimes you go notice say your belly don't begin increase, the time like say na water dey na the belly. Or you wet, the way you dey plant wet, try dey notice where you dey wet again. So depending on which of your organ don't begin ambog, now that way you go present with signs and symptoms. So man then the foot they begin swell. So you dey see say any side way pipe they go, pressure they affect the. So man even the eye self they not go they see clear. Say when they go one go see the eye doctor go tell them say now you pressure where they up now they affect your eyes too. So any side way pressure they go, we they get problem there. So now that make we would don't see say the main hypertension in self it actually no they cause any symptom. So if you want able for catch them early where you not go reach now the time with complications they don't come in, it means that even that day where you they feel okay, you don't feel like you sick, you for just learn and cultivate that habit day for the go to hospital once in 6 months or once in 4 years for go get a checkup. But let them check your blood pressure and make sure say you okay. So we want to know waiting for do if I begin feel any of these symptoms then, or I just want to take this advice here, I'll go for routine checkup now hospital. Now the best thing that they for do for the first time where you go now hospital, where you want to check your blood pressure, now for go now hospital. Why? Because now they will get skilled health workers them we go able for check them properly. When you go now hospital, then go sit down, then check your blood pressure. By right way, then they check them. If you don't sit down for like 10 minutes and rest, because even that stress of the worker, they able for increase your blood pressure temporarily. When you don't sit down, your blood pressure they normalize. Then give you 5 minutes and at least you know for don't eat or drink 30 minutes before you go take your blood pressure. You sit down with your foot down, then go come with the right side of cuff for you. We get the different types there. We get the manual type and we get the automatic type. You get, if they are hospital, mostly you can find any of them to then day. But the only advantage is that the manual type is more accurate than the automatic. Because we know say the automatic, some na charge then can use, some na battery then can use. And if you're not charged fine or if the battery not fine, it's more likely for give you a wrong reading. But then it's easier for use and anybody able for learn for use them. But the manual, it need more skilled hands for be able for operate them. But in are the most accurate one. So then go find your size, then check your blood pressure. If it's normal, then go tell you say it's normal. But if you're abnormal, even that one great time when they use for check it's not sufficient enough for me person tell you say you get high blood pressure. They need for take like 2 or 3 times studies they show say minimum of 3 terms na accurate. Then the person go take, the healthcare worker go take an average of them 3 then day. If you persistently high in each of their readings there, then also when they take you history, they're able for pull out 1 or 2 risk factors then they go able for get enough information for know say yes, this person gets high blood pressure, and from there your healthcare worker go advise you on waiting for do next. If your pressure okay, then go say advise you on how for change some of their lifestyle, their modifiable risk factors that we don't mention, like alcohol, smoking, activity, we food them, and all that, and then they will give you counsel, and then you go back. So what's happen now after if they don't tell you now, say yes, my pressure they up consistently in then 3 readings then day, I get high blood pressure. High blood pressure na a sick way chronic. That's to say not to malaria where you go able for take 2-3 days medication, you go say I don't well. No. So when they don't tell you say you get pressure sick, do ya where they mark medicine for you, not go back now house where 1 card done, you say I dey feel better now, the pressure done. Not to so. Pressure na a chronic illness. You need for day on your medication for as long as possible. We know they try for cure them, we they try for manage them, because certain things and they certain situation and certain lifestyle where you day on continually. So even if today you pressure day down, sometimes tomorrow your pressure go day up. So you need continual monitoring, and you need for be on your medication as long as possible, unless your doctor advise otherwise. So if they don't tell you say you na pressure patient, you doctor go able for advise you on things then for do. He go sit down and then tell you about different things then. If na smoke you dey smoke, you know say yes, easier said than done for let you quit smoking. You can actually start by reducing the amount of cigarettes where they smoke for day or any other thing where they smoke, and then gradually till you able for quit. If na alcohol, you reduce your alcohol intake. If na obesity, and one of the things that we then go do also now for test you, we get for do boku blood test them, because as we don't see, we get sick then where they cause blood pressure. Sometimes the pressure not to for their essential causes them now underlying sick then where you get where they cause the pressure for go up. So your doctor get for do a lot of tests there. With the hear someone then go say, oh, now me pressure no more day up. This kind boku test this one and they give it for do. But then at the difference standing between the pharmacy and the hospital, your doctor not just they treat the blood pressure alone, he also they try for prevent certain complications then for coming, and for also look at you as a whole. Maybe something apart from the complication, other things then they will go able for prolong your life if you dey on their medications then they. So we get for do some certain tests, and as well as then get for weigh you as well, because we don't say one of the risk factors there now waiting obesity. And we normally we can get this idea say if you go team up on top weighing scale, you see say you pass 70 kg, you go begin engat, I don't get weight, I need for push my body down. But no, not to that way they would use for tell if person underweight, get normal weight, or overweight. We they use what we call a BMI, now body mass index, now a scale. They take into consideration not just your weight but also your height. So now the proper way than they for check if you underweight, you get normal weight for your age, or you overweight. So where they don't calculate your BMI, then go able for tell you appropriately if you go need for lose weight and you go need for involve in more physical activity or not. So we see say you get boku benefits for the first time than the way you want to check your blood pressure for go let you go now hospital so that they go able for evaluate all them factors then they. So after your lifestyle modifications where your doctor don't advise you on, when are the most important ones there, then we can go over to the medication. An average hypertensive patient will get maybe about 3 to 5 medications then where it go they take depending on the findings then where the doctor see. So obviously we know say with multiple medications that we person they take, you get for strain. Sometimes then they for they take one tablet except for that 3 days. Some of you know they will even complete anti-malaria before you say you the day on 3 to 5 medication every day for a long period of time. But we need we need the family support, we need the understanding, because if you know what you take each of them medication for, you're more likely for continue for take them, because then will help you. And the moment they don't put you on this medication, all man know but amlodipine, all man know but aspirin, all man know but other medications, and they will then can put them on. But that not mean say you for share your pressure medication with other patients where then say get pressure. No, because the pressure then get different classification and different stages, and based on the stage where you dey, your doctor will put you on a certain type of medication. The stages then they according to how high your pressure dey. If your pressure they reach more than 180, more than 20, your doctor will advise you say let me admit, because you're more likely for the at risk of certain complications than they. So but if the person pressure depending on the stage where it dey, in doctor go either put them on one antihypertensive or 2 with aspirin and some other risk modifying medications there. So if you feel say you see your other company back we get pressure, they take this medicine, so you back one go take them, it's not ideal and it's not advisable. And then as long as you don't do on your medication, we know all say a long-term medication, you get for the go time to time for the check your pressure na hospital. If you're not able to afford for the go na hospital every time for the go check your pressure, you can also buy the automatic machine. Then they are very easy for use. You just need to make sure say the battery they work fine, or you have the one where they charge, you make sure say it charge properly, so you're not going to give you wrong reading. And then you go get a book where you go to record your blood pressure. If you check on this morning, you record them. If you check on evening time, you record them. So maybe if now after 2 weeks your doctor give you appointment, or now after 1 month your doctor give you appointment, you go able to get an idea of how well your pressure they controlled on the medication. If your pressure not they control back, you say will notice them and then go tell you say if the pressure pass this and it pass this, I for come back now hospital. We also know say not so everybody go able for afford for get an automatic pressure machine at house. We know say most of them pharmacy outlets them, then they give free blood pressure monitoring to patients. And you can also make use of this opportunity for able for go they check your pressure normally, regularly, and then if problem day, then can refer you to the hospital for you go see your doctor. So we don't talk about the importance of continuous monitoring. We also want to talk about the complication of hypertension, where we know say most times there, as we don't explain about how the sick they turn, where the sick actually okay, you know, they feel nothing. So sometimes then they will patients actually come to hospital where they don't begin feel something, they don't already get the damage to some certain organs them. The heart is a very wise organ in the sense that before it pump blood to other parts of your body there, it pump blood to yourself. But just like with young man normal where you see then the ace iron, as the ace iron, you give them 3 weeks, 1 month, they still say the muscle they begin for heart beef. Now the same way, if your heart continue for the pump blood at a very high pressure for a long time, the heart intercept they begin for big pass how it for big, and then when time reach for lay it rest and lay blood can inside, you not go able for rest fine, blood not go able for flow up the heart fine. So you go see say blood maybe where they go to the heart itself not go be sufficient, and any side where blood no they that tissue they likely for die, and if it die it lost in function. So if a significant part of the heart they don't lost in function, it they lead to what we all know as heart attack. We call it myocardial ischemia. And where that heart attack don't happen, we know say the mortality associated with heart attack is very high, especially in a way-on situation. So when you see patients begin come with chest pain, you go know say this likely a heart attack where this patient don't get from uncontrolled hypertension. That's to say hypertension where it not be they take medicine for, or it not be even ever know say it get hypertension. Then also some people then go begin notice normal say where they walk a few distance, then they strain their heart, they flow up when they come to hospital, then go see say the heart so overloaded, water don't begin settle all inside their lungs, they're not able to blow again. All that then are a sign of a complication of of high blood pressure. Even with kidneys, we all know how it's very, very expensive for managing patients who get kidney disease. Hypertension, they cause kidney problems because we blood not able to go sufficiently in the kidney, problem get for day. You not go able for filter your blood fine, you not go able for produce urine fine, water go begin for accumulate inside your body, and then you get for begin for strain and you not go feel good. And all of them diseases them, majority of them, especially in this area where we find ourselves, get a very high mortality. That is to say, the deaths them associated with this is the rate of them is very high. So we see say we don't talk about all things in there. The prevention it look better past the management. So what it will take you for prevent high blood pressure. Now just for change your diet, become more physically active, avoid palm oil, avoid that oil they will get boku fat. Where you go na market, they say give me that oil they will get low cholesterol, because boku cholesterol we don't learn say it able go block pipe inside your body and it stop blood for pass for go outside if for go. So me people them, I know say it's not easy, and most of them factors them for you able for actually incorporate them into your lifestyle. It's a little bit challenging, but now we don't aware, we able for know waiting for do, and they encourage each and every one of you for make use of that opportunity. If you're a young man, you know say now the family when I get history, you get mama we been get pressure, you get papa we been get pressure. In fact, studies show say even person we not born a family we get pressure, you still get like a 3 to 5% chance of coming up with pressure. And that chances they even multiplied and even increase if you get any of their risk factors them added. And then also where now you get the family history, you did about 45 to 60% chance of actually coming down with this pressure. A majority of we they ask, I get pressure na my family, I get pressure na my family. Now enough indication that they follow you begin check your pressure regularly. If now after 6 months, especially you don't pass 18, you don't pass 20, or you don't pass 30, you go regularly for the check your blood pressure, so that at least by the time when they know say you get this pressure sick here, you don't already take your medication, and then you don't already increase your life expectancy, so that these complications they no go start setting earlier than necessary and then cause problem inside in life and then shorten your lifespan. So I encourage each and every one of we go check your pressure. If na pharmacy, if not even go na hospital, you can drop by na any pharmacy, then check your blood pressure. And we as young people then we will begin learn for the day more active. If na Saturday, you and your friends they wanna go na beach, the young man then they play ball, the woman they able for also play ball or ride bicycle or do something active. Swimming is also a very good exercise. So learn for think of all them factors then they and put them into consideration, so that we go able for reduce prevalence. Maybe in the next 5 to 10 years, if we do a statistics, we go begin notice say salon we been do this studies some years back, now this will be fair, but now we don't check back. People they actually they intentionally they listen, they take care of their health, they adjust then risk factors then and then they try for do changes for make sure say the prevalence of pressure sick actually reduce now in country, and then with life expectancy go also reduce. So thank you.
Oh, well, we don't come to the end of the program. Doctor, thank you for where you don't highlight the problems there are and make we understand what this pressure sick here. Because one kind of way, if I know the understanding here and know how far we can able do. So thank you to all my way joined with today. And don't forget to follow TDN Africa Media. We go there back live on YouTube and Facebook every Monday, same time, 3 p.m. You can follow we live on YouTube. We can do live on every Monday, same time, 3 p.m. You follow we on YouTube, Facebook, Instagram at TDN Africa Media. Was this cut or no?